Hi there. So typically my videos, I'm giving exercises or tips and tricks physically for how we can improve our core and pelvic health. But today I want to talk about my pregnant mamas. Those of us or those of you that are expecting or planning to expect a baby in the future. I want to talk a little bit about how do we prepare for delivery. In our culture, the biggest discussion is, going to those prenatal visits. We're checking the baby. We're making sure baby is developing well and that they're healthy. We might go to a childbirth education class. Usually for that first baby, we're getting educated on what to expect in the hospital, different positions we can get into to help with labor. We're learning and being educated on things like medication, medical interventions. These are all really good things. We want and need all of these things. It does help for a healthier pregnancy, helps improve the viability and health of our baby. But I find as a mom myself, having 3 pregnancies and a pelvic physical therapist, that one of the biggest things that is missing for us is actually physically preparing our body for labor. Now, it might seem quite revolutionary to think about this, but if we were heading towards something that requires and demands a lot of us, it makes logical sense that maybe we should actually physically prepare our body for labor. So typically pelvic PTs are seeing women for issues like pain, back pain, pelvic pain, urinary leakage, pelvic floor heaviness, and there are some other things that we can experience while we're pregnant. So typically, and over the last decade, I've seen women for these things while they're pregnant. Sometimes I will have an awesome midwife that does realize that their patient has a lot of pelvic floor tension, and they know full well that we want to improve their chances of a successful vaginal delivery. So they say, go to your pelvic PT, go to Buffy, have them make sure that your pelvic floor is not in spasm, which is fantastic. And over the years, as I've helped women with back pain, pelvic pain, I found that the vast majority, just like all of my patients, are quite disconnected from their pelvic floor. Do we know where they are? Do we know what these muscles are supposed to do? What are they supposed to feel like when they contract versus relax? And shockingly, over the years, I realized that so many of my patients, oftentimes the majority, had almost no ability to actually consciously relax their muscles. So they were basically used to having their pelvic floor in a state of tension. When I asked them, and when I was assessing their muscles, their pelvic floor muscles internally, and I said, okay, can you take a good breath and release your pelvic floor? Pretty much everyone kind of went, no, they couldn't do it. So I have slowly come around to realizing, and we are not taught this in our PT programs, in general medical culture, that, oh my gosh, if 1/3 of all deliveries in the United States are going to be C-sections, then we can do better. So as I've found that the majority of my pregnant patients cannot relax their pelvic floor, this is exactly what we're supposed to be doing when we deliver a baby. When we quote unquote push, do people know what that means? When I compare notes to other women that have delivered babies, birth workers, doulas, and midwives, oftentimes they agree that most women do not know how to push. So I have found that I've become a pushing coach. As a pelvic PT, I help women prepare how to push, but oftentimes the first thing that they need to learn is how to let go. They need to learn how to relax their pelvic floor, because the last thing we want is labor to come on, labor to get stronger. It feels intense and sometimes painful, oftentimes painful. And we don't want your pelvic floor muscles at the bottom to do what they often do, which is in response to pain, they will tense up. So that's where baby's coming out. So we don't want to be having all these contractions and having muscles going, oh gosh, this is really uncomfortable, I'm gonna grip. so that when oftentimes women are told that it's time to push, things are getting pretty intense, the labor contractions are really, really strong, and if they've never learned how to relax their pelvic floor, it can become really tricky to even let go, because all they've ever been told is to do Kegels, which is what? Contract and lift. So often women are pushing for many hours, but we're not even really sure if they're actually doing that. They've never been coached, they've never been educated on what their muscles do, that they are supposed to contract and lift, but also relax and bulge and lengthen. And so I'm able to see and catch the patients that I do get to see when they have these issues, when they're kind of are stuck in spasm. They might not even have a history of pelvic pain or pain with intimacy, but their muscles are in absolute spasm. So we help correct that. They learn how to connect with their pelvic floor, they learn how to release, and guess what? They tell me after their delivery that they were able to breathe out their baby for the most part. Not every single patient. There's going to be variability with our labors. Things will happen that are not expected. It's one of the most uncertain things that we can go through in our lives. But for the majority of my patients, they have learned to let go. They've learned how to connect with their breath, connect with their pelvic floor, have a much easier and smoother delivery. Oftentimes it's women that it's their second pregnancy, and they see how different their second pregnancy was compared to their first, when they had no connection with their pelvic floor. And here's the other part. They already have learned how to connect with their muscles and their entire core system with their breath. So they're already ahead of the game when it comes to recovering postpartum. They don't have to learn something new when their muscles are on the other side of delivery and they're healing and recovering. They know how to breathe and connect, and they usually recover much quicker. So that is where I am definitely an advocate for pregnant women now, and I would highly recommend that in our second trimesters, we are seeing a pelvic floor PT. I say second trimester because we usually don't want to do internal assessments in the first trimester. It's just a time period where we want to be much more cautious. But if we're cleared to be physically intimate with our partner still, we should be just fine to have a muscle assessment, which is just on the outside of the pelvis. We're getting nowhere near the cervix, to help you understand how to connect with your body, and so that you feel empowered to have a really good vaginal delivery. Because there is more than trying not to gain weight and worrying about packing your hospital bag and making the baby's room look amazing and cute and buying all those things. We actually want to make sure that we are prepared, because as awesome as our birth team could be, the doula, a midwife, a doctor, OBGYN, they are not going to deliver the baby for us. Actually, we're the main thing. It's our show, and we can actually have much more control over how our delivery goes, with how empowered and how connected we feel with our own body. So I would highly recommend that you reach out to your local pelvic PT, find that alliance with that professional, because not only can they help you prepare for your delivery, likely at that point, you can send them a message just after you deliver if you have any questions, and they're already on your side. They're already on your team. You don't have to look for some strange new person in a point where you are exhausted, tired, and short on time. So if you have any questions, you can reach out to me. I'd be happy to help you find a local pelvic PT if you're outside of the Portland, Vancouver neighborhood. But for all of you planning on having a baby, or you have a labor coming up soon, let's get you assessed and empowered so you are ready for your delivery.